So this is an old graphic from actually the Health 300 text, but I like it because it really demonstrates exactly how tobacco smoke damages the lungs. Now, in our previous classes, we talked about how tobacco smoke damages the endothelium and results in atherosclerosis and heart disease, but this is what's going on at the lungs. And if you've ever seen any type of anatomy displays such as Bodies or Body Worlds where they show dissected bodies, you can see how the lungs are damaged and they're dirty from tobacco smoke. So if you look at the photos on the right, the differences between a non-smoker and a smoker, the non-smoker, you can see that there's not a very thick layer of cilia. It's not damaged. There are very few mucus glands within the lining of the air, the bronchial tissue. But when a person smokes, you can see that smoke particles invade the cilia. They cause them to produce extra mucus, and we have more mucus glands within the muscular layer of the bronchioles. So people who have chronic bronchitis and emphysema, they are going to have trouble getting air out because that lumen of their bronchioles is narrowed because of all that mucus and that extra inflammation, the thicker cilia layer. So we're not getting the nice lining like we are. So, and if you look at the alveoli become what's called coalesce. So we start to lose gas exchange surface area. So the small, little chambers that you see for gas exchange are going to get bigger and bigger and bigger until the person, eventually it can progress to the point where the client can suffocate to death. There are drugs that can manage these things, but, COPD is considered a progressive disease and it does tend to get worse over time. The alpha-1 antitrypsin COPD, as we mentioned, is the genetic form of emphysema, deficiency of the alpha-1 antitrypsin enzyme. So the lung starts to digest itself instead of dead tissue, and so you end up with destruction of the alveoli. So the lower parts of the lung are going to be affected first. These people may also have chronic bronchitis. Tends to affect, younger people in younger middle age. They can get the enzyme infused. I would imagine that comes with a pretty high cost because it's not a very common disease. They will take corticosteroids such as prednisone. They may need supplemental oxygen if their disease has gone on long enough. They're probably using some sort of bronchodilator. And they probably also get regular infections, so they're typically having antibiotics. So what are the symptoms of COPD? Overall coughing, particularly the smoker's cough, the cough that people get in the morning. So even if you have friends or family members that are younger, they're smokers and they cough a lot, they are on their way to developing COPD and chronic bronchitis. People who get short of breath. So shortness of breath with even mild exertion. So so a real mismatch for the amount of activity that they're doing. Excess phlegm, feeling like they can't breathe, feeling like they're stuck underwater, have difficulty taking a deep breath in, and people who are going to have difficulty with wheezing. Here's a review of pulmonary function terms. Dr. Bauer should have covered these in exercise physiology. We will do a spirometry lab and exphys too. So here, this should be a review. Your FVC, or forced vital capacity, the maximal amount of air. You take a maximal deep breath in and you take a maximal deep breath out. So that is your forced vital capacity. And then the residual volume is what remains after, you're at that final expiration. That's the amount of air you cannot get out of your lungs. And if someone, say an athlete, gets what, quote unquote, the wind knocked out of him, they have knocked into that residual volume. The FEV1 is the forced expiratory volume in 1 second. So that's how, that's the amount of air that you can breathe out in 1 second. And if you've done the spirometry lab, then you're probably familiar with that. And then the FEV1% is looking at the FV1 divided by your forced vital capacity and then multiplied by 100. And that can be an indicator of COPD. Tidal volume, TV or V sub T, the amount of air that within a normal breath.